All right, I said going into those announcements, if you suffer from allergies, if you have those kinds of concerns or questions, and we're going to try to tackle those right now as we discuss allergy season with someone who is from MU Healthcare, professor of clinico. I'm going to try this, otolaryngology and expertise in allergy. And is it rhinology?
That's correct.
And that would be Dr. Christine Franzese. It's nice to have you as a guest. How are you today?
I'm doing well. It's a pleasure to be here.
I asked you off air if you suffer from allergies, and you do a little bit, huh?
I do a lot, actually. When I grew up, I suffered from eczema, asthma, and allergies, which is sort of the triple play in allergies, and that's what got me into this business.
So do we need to be diagnosed if we have an allergy, or can we just kind of deduce that we have it because of certain things that happen at certain times of the year?
Most people will figure it out. I mean, the typical symptoms, sneezing, itchy, watery eyes, clear, runny nose, itchy throat. Some people will get hives. Most people will figure out those are allergic symptoms. Sometimes you can confuse them with a virus, but most people have already figured out they've got allergies and have taken some kind of over-the-counter medicine.
So where are we in the allergy season right now?
So we're fully into spring, which is generally the tree season. So usually around late January, beginning of February, we see the trees start to bloom. Now, when you have those strange frosts, as we had a series of them, that tends to push back some of the pollen blooming peaks. And so then you'll get a big pollen burst as the weather warms up and we catch up. But we're still in tree season.
So I've noticed over the last week or so, especially where my family lives, we have huge trees. And I did some house cleaning over the weekend. And as I dusted some things right next to the window, I looked at my dust rag. It was just yellow from pollen. I mean, it was just amazing. I mean, it was really, really yellow. And I know it's on the cars, any cars that are left outside. And then little fuzzy things that are about an inch or an inch and a half long. And they've got these things, and you grab a hold of them, they come off of trees, they just disintegrate. They are really prevalent in our neighborhood. So these are all things that would carry with them. If somebody has an allergy, these would carry with them symptoms, right?
Potentially, yes. If you are allergic to them, if you're sensitized to them and you come in contact with them or inhale them, then you get symptoms.
So you told us you said people kind of figure this out on their own and then they use over-the-counter medication. Is that enough?
It depends. So if you take an over-the-counter antihistamine or a nasal spray and you're bothered, say, like 1 week a year, you can easily control these symptoms, and that's really all you need. But a lot of people start to just suffer with these symptoms. I've had people tell me with a straight face who couldn't breathe out their nose that no one can breathe out their nose. And I want to clarify that that's not true. It's actually normal for you to breathe out your nose, but you become so used to this misery that's just normal and you don't feel you can do anything about it. And that's actually not true.
They say that people don't breathe through their nose.
Yes.
They've just gotten so used to not being able to do that. So what do you do for those people? How do you make it so that they learn, oh, yes, the nose is there for breathing?
Help them. You can, and there's a number of ways depending on how severe. I mean, for really severe flare-ups, sometimes we have to use steroids. Other times just getting them on the appropriate nasal spray or medication. And then for those people there's a lot of people that hate medicine. They're just looking for something else. They'd prefer almost like a cure. That's where we talk about immunotherapy.
What is that?
So that is, most people are familiar with that as allergy shots, allergy drops. There's allergy tablets now, and we have allergy toothpaste. But basically, it is making you not allergic to what you are allergic to. It's developing tolerance.
There's allergy toothpaste?
Yes, it's called oral mucosal immunotherapy, but in layman's terms, it's allergy toothpaste.
So you brush your teeth and somehow that medicates you or works up, I guess, something through your breathing?
So the way it works is we mix individually, depending on what you're allergic to, in a toothpaste base, an allergy serum. And you will brush your teeth with this, and it's real toothpaste. It's like dental approved. It does not have fluoride, though. So if you need fluoride, you have to do something else. We work that out. There are cells in your mouth that then take up the antigen, and they process it, and they break it down, and they do the same mechanism that happens with shots when you develop tolerance. It's just a different way to get it into your body.
I had never heard of this before. I'd never heard of allergy toothpaste. Now, do a lot of people use this, or is this kind of something that's very rare?
This is new. Actually, it's only been out for the last 2 to 3 years. So there's some small studies that show that it works. We've used it in our practice and it works, but it's up and coming. They're actually looking at it to develop it into a product to help with peanut allergy.
Oh, really? Mm-hmm. So what do you think about the nasal cavity flushes? And I don't know what the brand names are or what their commercial names are, but things that people sometimes are able to do by putting a solution through their nasal cavity.
Those work great. Those actually have been shown in some medical studies to be just as effective as some nasal sprays. So I encourage my patients to do them. It's a very easy way to just flush the pollutants and pollens and allergens out of your nose a couple times a day.
Do you have any other advice for, I think typical advice is that if you're going to suffer from allergies, you don't sleep with your windows open.
That's right. So don't sleep with your windows open. If you have an idea if you're allergic to trees, you don't want to jog in the morning because that's when trees pollinate. Conversely, if you feel like you're allergic to molds or you've been tested and you know you're allergic to molds, the evenings or rainy times, not heavy rains, but light rains when it's cooler, that's when the molds sort of sporulate. If you're outdoors working, once you come in, take off your outerwear and shower. Those are easy things that you can do.
So when do people usually come to you? In other words, at what point? Is it when they say something is just to the point where I can't function like I want to function? Or what is the stage where they come and say, I need to see a doctor?
Some people come because they're just curious as to what they're allergic to. They know they have symptoms and they're trying to pinpoint it and they can't figure it out. Other people come because they've either tried all the medicines and none of the medicines work, or they kind of work but not enough to give them relief, or they're just sick of taking 2 or 3 or more medicines to get relief.
So do we work up immunity to these kinds of medications for allergies?
It's actually genetic as to how you respond best to a particular antihistamine or nasal steroid spray. And there's actually genetic testing that will tell you which one you respond best. What it really is when people say, like, I seem to have developed a tolerance, you do a little bit, but what it actually is like when we give someone a blood pressure medicine, there's a whole range of doses, and you start at the lowest and you go to the highest. There's actually more than one dose for each allergy medication, but the problem is the more of it you take, then you get sleepy, and they like to market it as non-sedating, so that's why they only advertise one dose.
I think I understand that. So in other words, we're not working up a tolerance to it. It's just maybe we don't have the right amount.
Sometimes we need a higher dose. You need to take
But if you take a higher dose, then all of a sudden you might be showing certain reactions to the medication that they promise you're not going to have.
Yes, which is sleepiness. They don't want people to get sleepy.
Is it important to know what we're allergic to? In other words, like you say, trees. Would I need to know that I'm allergic to this type of tree and not the other type of tree? Or is the treatment going to be basically the same no matter what it is?
Well, it matters if you want to do immunotherapy. So if you want to develop a tolerance to something that you're allergic to, you have to know what you're allergic to. In some ways, it can be helpful, though, for environmental measures. Like if you suspect that you have a pet and you'd like to know if you're allergic to pets, that can be helpful, although normally you'll get rid of your doctor before you get rid of your pet. So I don't encourage that.
So if your doctor says it's your pet, then you're going to say it's a new doctor.
Yes.
Anything else? So tell us again what would be indications that we might have minor allergy problem at this time of the year.
So some sneezing, some clear runny nose, nasal congestion. Some people will get some sinus pressure. Some people get itchy throat, itchy nose, itchy watery eyes, maybe some red eyes. Those are kind of minor symptoms. If you have asthma, you might wheeze or cough.
What I have today where I just feel like my throat's really kind of constricted. It's the only thing that I would say that I've got is any kind of symptom. That's probably something else.
It may be, it kind of depends. That could be a little bit of reflux, a little bit of dehydration.
Dehydration. Well, I like that. It probably is a little bit of dehydration because I felt that a lot last night. I felt like I couldn't get enough water. I just like I spent too much time, I guess, outside or something like that and hadn't replaced the fluids that I had lost. Well, I think that it's something. Is there a percentage of people that probably have an allergic reaction to certain things going on in spring? How widespread is this?
I think in general numbers are quoted that about 40% of people will have an allergic disorder.
but not near that number need to have anything done about it. I mean, most of this is just kind of an annoyance rather than a real problem.
Correct. So I think they estimate about 20% of people really need to seek care, but only 5% of those end up going to get something.
Wow. The rest just suffer.
Yeah, mainly because of the stigma of allergy shots. There's a lot of people that are afraid of needles or they just don't want to do that. And they're worried if they go see an allergist, the allergist is going to say, you have to get shots. And that's not actually true. We have lots of non-shot options.
They get referred to you. So their regular physician would say, okay, something is beyond what I'm going to treat, so go see her.
Yeah, or nowadays, a lot of insurances don't require referrals, so people will just call us to get help.
And you're at MU Healthcare.
That's correct.
Expertise in allergy and
Rhinology.
rhinology. Professor of clinical otolaryngology. Otolaryngology. Well, Dr. Christine Franzese, thank you very much for being here today.
You're welcome.
It's
Thank you.
News Talk 1400 KFRU.